whenever somebody comes into the office at Caring Medical and they have end-stage osteoarthritis, right away they say, well, should I get stem cells into the cartilage? And I have to go through the degenerative cascade of actually what causes the articular cartilage to actually die. So osteoarthritis is actually a whole joint organ disease, and under a microscope, when you look at the tissues of osteoarthritis, you're going to find that there's a deficiency of cells, which I call a cellular deficiency. The cells actually die, and what causes the cells to die is destructive joint motion, because the connectors of the joints, the ligaments primarily, though in the knee, the meniscus too, those joint connectors are not strong, so you have shearing forces or rotational forces which are causing the damage to the ligament tissue, tendon tissue, subchondral bone, which is the bone underneath the cartilage, and the articular cartilage, to the cells to actually die. So the actual hallmarks of osteoarthritis is, the first most important thing is ligament damage. What I think is the second most important thing that occurs is damage to the subchondral bone. So when the subchondral bone, the bone underneath the cartilage, gets damaged, the body tries to repair it, so that bone actually gets sclerosed, where there's more calcium in it, so the body's trying to strengthen it. But the problem is the cartilage in the meniscus is now sitting on something that's hard. It's not cushiony, so the subchondral bone loses its cushion. So when a person takes a step, then the meniscus and the cartilage doesn't have a cushion, so the meniscus and the cartilage starts getting cracks in it because there's so much pressure. So then the meniscus gets degenerated, gets tears, and then eventually the articular cartilage gets degenerated and tears. And the body, to try to stop the destructive joint motion, will overgrow bone. So the overgrowth of bone, or bone spurs, is the body's last chance to try to stabilize the unstable joint or to stop the destructive joint motions. So the treatment of osteoarthritis should be to stop the destructive joint motions, like the treatment starts there. That's why all people who get treatment for osteoarthritis, whether or not they get stem cells injected, need to get prolotherapy to tighten the ligaments to stop the destructive joint motion.